welcome to our Facebook Live event. I'm Dr. Leslie Phillips, Senior Director of Research Insights and Innovations and in-house epidemiologist at SEIU 775 Benefits Group. For caregivers enrolled in health coverage with Aetna and Kaiser through SEIU 775 Benefits Group, you get convenient, free, and low-cost healthcare anywhere, online or by phone. And these virtual care options are more important now than ever before. We'll talk today about those options with our peer mentor team, who have direct experiences with them. We've all had to change how we do things in this pandemic, from social distancing and wearing a mask to even the way we see a doctor. As we enter cold and flu season, it's important to know what options are available to you as alternatives to going to the doctor's office. Unless, of course, it's a true emergency. A broken bone, chest pain, things like this require medical attention in person right away. Today, I am so delighted that peer mentors Tammy and Pamela will be sharing their virtual care experiences with Kaiser. We'll hear what they're doing to get the convenient, free, or low-cost care they need while keeping themselves and their communities safer.
Yes, and we want to hear from you too. If you have an experience with the virtual care that you'd like to share, or if you have any questions for us, please leave a comment below and we'll be sure to talk about it during this event.
Before we get started, I'd like to ask our peer mentors to share a bit about themselves. Pamela, can you start?
Yes, Leslie. Hi, I'm Pamela, and I've been a caregiver for over 5 years.
Hi, everyone. My name's Tammy, and it's great to see all of you again. I've been a caregiver for about 6 years, and I am a peer mentor for the Benefits Group.
Thanks. As we all know, COVID-19 has resulted in big changes in the way we do things. Getting medical attention is no exception. For many people, going to the doctor's office in person right now feels uncomfortable. So virtual care offers a great and a safe alternative. I know that many caregivers already use virtual care, and it's important to know what your options are for getting the care you need. Tammy and Pamela, can you talk about the virtual care options that you've used?
Yeah, thank you, Leslie. I'm thrilled to say that I use these virtual care options on a regular basis, like the Kaiser mobile app to message my doctor about any and all of my health concerns. More importantly, I was able to continue to see my therapist via video visits during the pandemic.
Thanks, Tammy. I've used a bunch of virtual healthcare options as well. The Kaiser mobile app, messaging my doctor to get advice. I've used the consulting nurse phone number as well, and I've done a video visit.
Thanks for sharing. It seems like you've both had positive experiences with Kaiser. I want to remind our viewers who are on Aetna that they too are eligible for virtual care. If you check out the comments, you will see a link to Aetna's Healthcare Anywhere. Pamela and Tammy, can you talk about what you liked most about virtual care benefits?
Yes, Leslie. What I liked about using virtual care was that it was cost effective for me. I didn't have a copay with Kaiser, and I was able to have access to my doctor right away. I feel like it improves patient engagement and satisfaction when you have one-on-one time with your doctor. Also, being in my own home and not having to wait in a waiting room was pretty great. And I didn't feel rushed with my visit, which makes it more personal.
Wow, Pam, that's so great to hear. My experience with Kaiser has been super positive as well. I love all the virtual care options that they offer. If you're anything like me, finding time to go to the doctor can prove really challenging. My most recent experience was really great. Instead of having to go in and see my doctor to get the referral that I was looking for, I just got on the app, I sent her an email, it was super quick and easy, and I got the care that I needed right away.
Yeah, it sounds great. I'm going to dig in a little to the how. I mean, how do you do this? Is it easy to find?
Yeah, for me, it was super easy, as easy as downloading an app and clicking on a link that was sent to me via email.
Yeah, Tammy, I found it really easy as well to use the technology for virtual healthcare services because they send you updates about your appointment. They sent me a link to my phone so I could go onto my account and see my doctor's notes and not forget anything that was mentioned. It was easy to find it was easy as well for medication since the doctor called it into the pharmacy right there through their computer. So again, I didn't have to wait. Virtual medicine is a great way to be helped faster, more efficiently, and definitely conveniently.
That's great. It seems like a lot of changes to the way we go about work and life. Well, they're here to stay, and I suspect that virtual care may be one of these. With that in mind, can you share a specific virtual care experience that was valuable to you? And for those watching, use the comments to share about how you've used virtual care. We'd love to know. Can you start us off, Pamela?
Sure, Leslie. I wasn't feeling well, so I called my doctor's office asking for an appointment to get in. They asked me what my symptoms were and asked if I'd like to do a video chat with my doctor instead of coming in. Within 30 minutes, I had a video visit over Zoom with my doctor. It was very valuable to me and my situation. When I don't feel good, I definitely don't want to drive to the doctor's office and be seen. So it was great.
That's so true. I know that feeling, the irony of feeling too sick to get in the car and go to the doctor. And yet, when we aren't feeling well, going somewhere is the last thing we want to do. And 30 minutes, it's hard to beat that kind of promptness. Tammy, do you want to share more about your experience?
Sure. During times like this where things are a little scary and so many people are feeling isolated and alone, it was especially valuable to me that I was able to see my therapist regularly by video visit, even during quarantine. I just had to find a quiet room at home and turn on my laptop, and I could be connected with them right away.
Thanks so much for sharing that, Tammy. It's really hard to imagine a time when attention to emotional health has been more critical than this moment. Being in isolation, not being able to see as many people, and now fall and winter are upon us and outdoor socializing will become less available. It's such a good reminder that taking care of your emotional health is more important now than ever. We're about to wrap things up, but before we go, are there any last tips that you'd like to share with our caregivers about virtual care?
Yes, Leslie, I would like to add, try virtual healthcare. It really changed my life when seeing the options that I had in my own home when it comes to my health, especially during this pandemic. Very, very helpful.
Absolutely. In addition to the Kaiser and the Aetna virtual care options, I would also like to mention the Ginger app. This is an emotional support tool that gives you access to a life coach 24/7. Someone who can help you create and follow through with your goals, as well as help you set better routines in your life. I will leave the comments to the app down below. Be sure to check that out.
Awesome.
Thank you both so much for chatting today, talking about your experiences with virtual care. Your experiences and stories are so helpful for other caregivers. And thank you to everyone who joined today. To Tammy and Pamela and everyone who tuned in, thank you. The work you are doing on the front lines to protect the most vulnerable in our communities is so valuable and important. Remember, giving good care to your clients starts with taking great care of yourself and your own health. For more information about healthcare anywhere and the virtual care options that are available to you, visit our website at mysciu.be/healthcare-anywhere. See the comments section for a link. For more information about peer mentors, COVID-19, self-care, and more, visit our homepage, mysciubenefits.org. You can also find contact information for the Member Resource Center, who can answer any questions you might have. Thanks again for joining today. Stay safe, wear a mask, and take care.